Hello. Today's topic is cancer of the reproductive system. Endometrial cancer. Endometrial cancer starts when cells in the endometrium start to grow out of control. 6% of all cancers in the woman, generally high rate of survival due to early diagnosis. Many factors affect the risk of developing endometrial cancer, including obesity, things that affect hormone levels like taking estrogen after menopause, birth control pills or tamoxifen, pregnancy, certain ovarian tumors, and polycystic ovarian syndrome. Use of intrauterine device, age, family history, having had breast or ovarian cancer in the past, having had endometrial hyperplasia in the past, treatment with radiation therapy to the pelvis to treat another cancers. What are the symptoms of endometrial cancer? Some women with endometrial cancer have no symptoms until the disease has spread to another organs. But endometrial cancer is usually diagnosed by the appearance of symptoms like vaginal bleeding as the cancer begins to grow. The most likely symptoms are abnormal vaginal bleeding or discharge. Before menopause, this means unusually heavy irregular menstrual periods or bleeding between periods. After a woman enters menopause, this means any vaginal bleeding unless she is on hormone replacement therapy. Vaginal discharge may range from pink and watery to thick, brown and foul-smelling. Difficult or painful urination. An enlarged uterus detectable during a pelvic exam. Pain during intercourse. Unexpected weight loss. Weakness and pain in the lower abdomen, back or legs. This happens when the cancer has spread to another organs. Cervical cancer starts in the cells lining the cervix, the lower part of uterus. Cervical cancer is the fourth most common cancer in women. Cervical cancer causes. Almost all cervical cancer cases are linked to infection with high-risk human papillomaviruses, an extremely common virus that transmitted through sexual contact. There are about 100 different strains of HPV. Only certain types cause cervical cancer. The two types that most commonly cause cancer are HPV-16 and HPV-18. Cervical cancer risk factors. HPV is the biggest risk for cervical cancer. Other factors that can also increase your risk include human immunodeficiency virus, chlamydia, smoking, obesity, family history of cervical cancer, a diet low in fruits and vegetables, taking birth control pills, having 3 full-term pregnancies, being younger than 17 when you got pregnant for first time. Cervical cancer types. There are more than one kind of cervical cancer. Squamous cell carcinoma. This forms in the lining of your cervix. Is found in up to 90% of cases. Adenocarcinoma. This forms in the cells that produce mucus. And the mixed carcinoma. This has features of the 2 other types. Many women with cervical cancer don't realize they have the disease only because it usually doesn't cause symptoms until the late stages. When symptoms do appear, they are easily mistaken for common conditions like menstrual periods and urinary tract infections. Typical cervical cancer symptoms are unusual bleeding, such as in between periods, after sex or after menopause, vaginal discharge that looks or smells different than usual, pain in the pelvis is needing to urinate more, often pain during urination. How is cervical cancer diagnosed and evaluated? In order to diagnose cervical cancer, we need to perform pap smear, colposcopy, biopsy. Pap smear, this examination is performed by scraping cells from the cervix. The cells are then sent to a lab where they are analyzed in order to detect any abnormalities. Colposcopy, this examination uses a low-powered microscope to view the cervix so a doctor can locate any abnormalities and biopsy the area. However, a biopsy may be performed without a colposcopy. And the biopsy, a sampling of potentially affected tissues with a needle. Body CT scan, body MRI, chest X-ray, and PET scan. Let's talk about cancer of the ovary. Ovarian cancer is the most lethal gynecologic tumors. It's genetically heterogeneous disease with poor prognosis, and despite the advances in technology and chemotherapeutic agents, the mortality from ovarian cancer has remained stable for the past 50 years. Although it's sensitive to platinum-based chemotherapy, the 5-year survival for the patients with advanced disease is only 30%. The high mortality reflects the advanced stage of presentation, including spread to serosal surface, abdominal or pelvic lymph nodes, and parenchymal metastases, as well as a high tendency for recurrence. Ovarian cancer risk factors. They are 50 years of age or older, familial factors, other potential risk factors such as early menarche, late menopause, hormone replacement therapy, first pregnancy at older than 30 years of age, and other. Subtypes of ovary cancer: epithelial, high-grade serous, mucinous, endometrioid, clear cell, low-grade serous, and germ cell, small cell, or Krukenberg. Common symptoms of ovarian carcinoma may include abdominal bloating, indigestion of nausea, changes in appetite such as a loss of appetite or feeling full sooner, pressure in the pelvis or low back, a more frequent or urgent need to urinate and or constipation, changes in bowel movements, increased abdominal girth, tiredness or low energy, changes in menstruation. Diagnostic procedure of patients with ovarian carcinoma: patient medical history and medical examination, complete blood count and biochemical profile, serum marker CA-125 and other serum markers, Papa Nicolau smear and cytology of ascitic fluids, TA and TVUS, cytoscopy and proctoscopy, radiographic studies, abdominal CT and MRI scan, laparotomy. Most women with ovarian cancer present at advanced stage. US is the first-line investigation of suspected ovarian cancer. CT is used for the assessment of the extent of tumor spread and look for other primary tumors which may be mimics, etc. within the colon. Image-guided core biopsy. A minority of women present with a complex adnexal mass without abdominal spread. MRI scan is available to distinguish complex benign from malignant masses. Thanks for your attention. Goodbye.